Hi there. Welcome to the Health Analytic Insights Podcast. This podcast is all about creating a community of like-minded individuals who are passionate about the field of health informatics. I hope to share information and advice in topics such as health analytics, digital health, biomedical engineering, and data visualization in healthcare. And in exchange, I would love to hear from you, dear listener, about your experience and interest in this field. You can drop me a line at HealthAnalyticInsights@gmail.com, and this email, along with any references discussed during this podcast, will be listed in the show notes below. If this resonates with you, don't forget to follow and subscribe to this podcast, as I'll be releasing new episodes bi-weekly. Before I jump into the episode, I wanted to let you know that at the end of the year, I'll be wrapping up the Health Analytic Insights podcast. I've had so much fun interacting with you, the listener, over the last 3 years, and receiving emails and comments on how these podcast episodes have helped you to learn more about the health informatics field. If you have any episode topics you'd like me to cover before the podcast wraps, please email me at healthanaliticinsights@gmail.com. Now, back to the episode. The American Health Information Management Association defines data governance as the overall administration through clearly defined procedures and plans that assures the availability, integrity, security, and usability of the structured and unstructured data available to an organization. And I believe this definition covers many of the aspects of data governance, and I'd like to highlight the integrity and usability portion of this definition. Some might see data governance as a way to gatekeep data in an organization, but I see it as a way that data can be used to its highest potential, because by keeping track of the different data elements collected within an organization, one can help reduce duplication and standardize the way data is collected so that down the line it can be used in an effective and creative way to make decisions. I also think the usability of the data is where we should be shifting our focus. We can collect all sorts of healthcare data, both structured and unstructured, as we've really gotten good at standardizing and understanding data pipelines. So now data lakes can store all different types of data. But what is the purpose of just collecting data if we're not using it in an effective way to actually make decisions and, within the context of the health informatics field, improve patient outcomes? And I find that sometimes data governance can be an afterthought, as people just want to, get out there and start collecting data, find new fancy tools like Python and R, and visualize the data using Power BI and Tableau. But applying data governance even before collecting the data can go a long way in helping to improve the availability and the integrity of the data. So we really have to take a few steps back and really start to analyze the process of how we're even going to start collecting this data. For example, during my master's degree, I worked with a large clinical data set which collected maternal and childcare data, and it contained survey data. This dataset was called the Pregnancy Risk Assessment Monitoring System dataset, and there were columns which had large amounts of missing data because some of the questions asked were sensitive, and it depended on who asked the question. For instance, if it was a nurse who had a positive relationship with a patient, there tended to be a higher chance that these questions would be answered. Without this data, I cannot make effective decisions. So even before thinking of the dashboard or the report that I was going to create, I might think, how can I carry out better survey design practices to increase the availability of this data? Another important benefit of having a data governance framework across your organization is the ability to standardize processes to ensure the data is consistent across the journey of the patient through a healthcare system. With consistent data, this can give rise to allow for pre-population, which can allow you to transfer data between systems, such as patient intake forms or surveys. Key demographic information such as age and name can be pre-populated across different medical forms, and this can help to reduce documentation burden for clinicians. With a strong data governance policy in place, this can help to cover patient cases where the patient might have to be transferred to another hospital for higher care. And then maybe once they've obtained this higher care, they can be stepped down to a lower level of care and can return back to the hospital that they first started their journey at, but still ensuring that the data follows their patient journey through these different transfers. A key step when applying data governance policies would be to consider building an organization-wide data dictionary to understand all the data elements that are being collected across the organization. This might provide insight into data elements that might be duplicated or collected in multiple departments, or might be called the same name but defined differently. This could be something such as the length of stay. One business unit might calculate it one way, whereas the other business unit might calculate patient length of stay another way. And then when it's reported, it's showing two very different numbers, and this can lead to a lot of confusion and mistrust in the data when external stakeholders are viewing these reports coming from the same organization, but it's calculated differently from different departments. Therefore, an organization-wide data dictionary can be helpful to define data elements for everyone to be clear about what and how the data is being calculated. So I previously did an episode talking about these large language models such as ChatGPT and Bard. And with the advance and implementation of these artificial intelligence algorithms, a strong data governance framework is key to ensure that these tools are evaluated with patient safety and security in mind. Data governance can be a challenge to integrate because it often needs to be thought about throughout the organizations and throughout different job roles, as everyone needs to be a data steward. And this would ideally follow with some high-level training about the importance of data governance, just like when you first join an organization, and oftentimes you get training in cybersecurity. And so having something in the form of data governance where people first join to understand how data should be collected and calculated and how it should be used would be a good point when it comes to ensuring data governance is established throughout the organization and not just sits with a certain role or department. So I hope this overview of the importance of data governance in health informatics was of value to you, and thank you so much for listening.